Welcome to the Art of Healing podcast, the podcast that is dedicated to helping you connect with your mind, body, and spirit. This is Charlize, physician and Reiki master, and thank you so much for joining me. I would like to remind you that although I'm a physician, the information you receive in this podcast is for educational and entertainment purposes only. You can find my full disclaimer at my website, www.healingartshealthandwellness.com. If you like what you hear on this podcast, sign up for my weekly newsletter. Check your show notes for more information and for the link to sign up. Thank you. Hello, and welcome to the Art of Healing podcast. This is Charlize, and thank you so much for joining me. This is a special episode. I am very lucky and privileged that I'm able to have a diabetic specialist and an endocrinologist who's going to be on the show, since the show will be airing in November, and this is the Diabetes Awareness Month. I had the opportunity to ask her to discuss diabetes. So let me introduce Dr. Rachel Kilpatrick. She is a full-time practicing endocrinologist who spends most of her time managing patients with diabetes and other hormone disorders, including insulin resistance, polycystic ovarian syndrome, thyroid disorders, adrenal disease, pituitary disease, and other complicated endocrine disease. She has a special interest in lifestyle medicine, and she's pursuing her certification in lifestyle medicine. She believes that most disease can be modified positively with lifestyle intervention. Dr. Kilpatrick is board certified in internal medicine and endocrinology. She did her medical school training at the University of Texas Southwestern Medical School, and she did her internal medicine residency and her endocrinology fellowship at Washington University in St. Louis. Dr. Kilpatrick is a member of the American Diabetes Association, the Endocrine Society, the American College of Physicians, the American Association of Clinical Endocrinologists. She's also a fellow of the American Association of Clinical Endocrinologists. So the following is our conversation about diabetes. I think this is going to be helpful, if not for some of us, life-saving. So I do hope you enjoy. As you are listening to this podcast, if you so feel moved, please leave me a rating. This is a small production, and it always helps us small shows. If you'll leave us a rating, it helps us go up a little bit in the ratings. So thank you so much for joining me, Doctor. How are you doing today?
I'm doing so fantastic. Thank you so much for the invitation to come on here and speak. I'm very excited to talk about our topic today. Wonderful.
So while I have your attention and I was deciding like this time is so valuable, I felt that we needed to talk about diabetes. This is a disease that if you don't have it, you care for someone that has it, you know someone that has it, you're at risk of developing it. So to launch us into it, would you mind describing the different types of diabetes?
Absolutely. I would be happy to do that. So just kind of taking a step back just to know sort of where my perspective comes from with all of my training. I currently practice in the state of Arkansas, and my practice right now is probably at least half of my patients have diabetes. And so in taking care of diabetes, it becomes very apparent the sort of heaviness of this disease and frankly, the frequency of the disease and how common it is. And so really for your listeners, I think it's very relevant to know about this because it's not this esoteric topic. It affects so many people. So before I talk about the types of diabetes, I'm just going to say a mention as to why this matters. So the prevalence of diabetes, at least in the United States, of course, some of your listeners are outside the United States, but 11.5%, I believe, is the most recent statistic from the Center for Disease Control. 11.5% of the population has diabetes. And up to, I think it's 38% of people actually have prediabetes. And it's almost half of people over age 65. So such an important topic, and just really drives home, I think, the fact that, the words that I use are maybe we are not evolved in a way. Our genetics are not evolved to live in the world we live in. So with that all being said, the types of diabetes, there are two very different types, and the rise is in both types, but really the lion's share of that is type 2 diabetes. So type 1 diabetes is a different animal altogether. We see that these are people who have developed an autoimmune disorder. They essentially don't make insulin anymore. Their cells in their pancreas, the pancreatic beta cells, have been attacked and no longer function, and you must have insulin to live. And so these patients require administration of insulin. Very different, contrasting to the patients who have type 2 diabetes, which is a disease really of sort of insulin resistance. And so typically that, understanding the disease comes from understanding the treatment. So we're trying to improve our insulin sensitivity in patients who have type 2 diabetes. So their pancreas is making tons of insulin, and it's just not doing the job well or well enough. So their blood sugars go high, and they develop diabetes. How'd I do?
So thank you. That was a beautiful explanation. Yes. I actually, and just for the listeners to understand, I'm an internal medicine doctor. If you're a listener of mine, you'll hear me use that term a lot. And Dr. Kilpatrick is a specialist in endocrinologist. So I actually did not know that the incidence of type 1 diabetes was starting to increase. I didn't actually realize that.
It is. I don't have the numbers in front of me, but it is going up as well. I think, a lot of these sort of autoimmune diseases, maybe we're becoming better at detecting it, but certainly with type 1, we do know that the incidence is increasing as well. So important.
Another question that I get from my patients, get from clients, from listeners, what causes diabetes?
Right, absolutely. Well, yeah. So, kind of what I was saying with regard to type 1, I think, there's this autoimmune destruction of the pancreas. And then type 2, there's a similar destruction of the pancreas, but it's not necessarily autoimmune in nature. So we know that at the time of diagnosis of type 2 diabetes, the average patient has lost at least half of the cells in their pancreas that make insulin at the time of diagnosis. And then those cells continue to die as time goes on. And so how the person manages themselves really impacts the outcome of if their pancreas is working and making insulin or not. So again, there's this also insulin resistance. So the patients not only are maybe making inadequate insulin for themselves if they have type 2 diabetes, but the insulin itself isn't working as well. They've lost the sensitivity. So risk factors for development of type 2 diabetes, which can then lead to this pathology, are, of course, being overweight or obese, physical inactivity. Smoking is actually a risk factor as well. And I think I said physical inactivity already. And then, an unhealthful diet, so eating a lot of maybe more processed foods can certainly contribute to that as well.
So I think most of us are probably familiar with the symptoms of diabetes. So I know on my end, when a patient first presents to me, they know that if they're really thirsty and they're urinating a lot or they're losing weight, that those are probably signs of diabetes. If you don't mind, from your perspective, maybe you could share some of the symptoms of diabetes that most of us actually don't think about, maybe some of the rare symptoms of diabetes, or some that you think of that the rest of us may not.
Great question. I love this. Okay, so One of the things I think that's important to point out in the world we live in is you have the opportunity to diagnose a disorder maybe before it's actually symptomatic. And so to that end, for your listeners, if you're somebody who doesn't go to the doctor very often, it might be a reason to make sure you are getting your regular health exam. Because the reality is, a lot of times when I'm seeing a patient in my clinic for, some other medical problem that they may have, then I somehow on their labs or something can see their blood sugar is elevated. We check it, it's abnormal, and they have no symptoms at all. So I think the point here is, especially for early type 2 diabetes, no symptoms may be the symptom. Other more subtle things that often I'll see is people will come in and say, oh, well, years before I ever developed diabetes, type 2 in particular, of course, I developed, I had numbness and tingling in my feet. So, neuropathic type symptoms that can be kind of a harbinger of something going on. And probably the most common symptom actually that I see in my clinic that is really apparent is simply blurry vision. That's a really common one that patients suddenly their vision changes. They can't see, they can't read as well. They can't see far away or close up. And so those are the things, no symptoms at all, sometimes numbness and tingling, and then the blurry vision. And then of course the typical things you think about for diabetes. So weight loss, feeling more thirsty, maybe getting up at night to urinate. That's one that's, pretty classic, but maybe not always talked about. So if that's a new thing. And then in women, yeast infections. So if you've got a, frequency in yeast infections, particularly vaginal yeast infections, that could be a sign that your blood sugars are high and you may want to seek out, medical evaluation for.
Thank you so much. That was a really, really good list. And as I'm dealing with my own patients, sometimes I get so drowned in the details that I forget those. I don't even think of the vision. I should, but that's actually one I won't think about till a little bit later. Wait, they did mention their vision was changing. So,
Right, absolutely.
Diabetes is a dense topic and it's a big topic. And I know for Dr. Kirkpatrick, same for me, that when we have to discuss with our patients what it means to be diabetic, it's just it's overwhelming. So I thought I would ask her, from her opinion, if you were diabetic, is there one thing that as a diabetic, no matter what made me diabetic, my immune system or, other things that added up in my life, what is the one thing that I should worry about the most today with my disease?
Oh, that's a good question. One thing, huh? Okay.
Of all the things you would worry about, just the one that you feel is the most important as a diabetes specialist.
Sure. But there's so many ways, I think, to answer this question. So I think, from my perspective, the big picture, okay? And it's sort of a lot of things. So I think that it's almost an impossible question to answer that way because of the density and the heaviness of the disease. And I always talk about the fact that diabetes has such a heavy disease burden. But I think the take-home point is the long-term outcomes and the fact that it's like compounding interest. So over time, if you make better choices and you have better glycemic control, meaning blood sugar control, that in 10 years or 20 years, you're going to have less complications of diabetes. And so it really boils down to those microscopic changes you make from day to day in your mindset about maybe not being perfect, but being able to make small choices to prevent those complications down the road. So it's hard to say one particular action or inaction necessarily. It's the long term that I see. And to that end, that's why we care, because who cares about diabetes, right? A lot of the patients, like I said already, come in and maybe they've had we see some pretty significant pathology. They've had blood sugars in the 400s and they're living and they don't feel bad. They feel great. And in fact, when I put them on medicine, they feel bad when their blood sugars start to turn to normal. And so the reason we care and the reason we don't leave blood sugars so high is because of, blood vessel damage, essentially. So we know that diabetes complications long-term, we can develop retinopathy, which is microvascular disease in the eyes, neuropathy, so microvascular disease in the feet, so you get numbness and tingling, and that can lead to, amputations potentially, one of the dreaded complications. And then, of course, nephropathy, so, protein in the urine, and eventually the potential for needing dialysis in the long term. And then the big thing, right, the thing that I always talk about, the thing that like most commonly leads to, poor outcomes with diabetes is cardiovascular disease. So the big blood vessels are also affected, the vessels in the brain and the vessels in the heart, the vessels in the legs, all over the place. So, those are the things that I think in the long term, those microscopic changes in your diet and lifestyle and making sure you're managing yourself can make a long-term outcome so that these are not problems for you, or they're less of a problem. And, my thinking with these complications is simply, I want patients to live better. It's not just about how long you live, it's about how your quality of life is. And so not having all these medical problems is, really important.
I think that's a beautiful answer. Thank you so much. I think that's a great answer. Yes. So as I was thinking about my diabetic patients, when they're speaking with me in the clinic or friends or family, I wanted to ask Dr. Kirkpatrick, and this might be a hard one, but we're going to try. What are the 3 things that you would want every diabetic to start doing today?
So the 3 things. Okay. So 3 things to start doing if you know you have diabetes. So number 1, just a plug for health providers. Every patient who has diabetes should see diabetes education. So every single patient, they are going to have it for the rest of their lives. They need to go to a, good, intensive educational place where they can really learn about these things. So from my perspective, the 3 things, if I had to pick 3 things. So number 1, I'm going to say, check your blood sugars and know what your blood sugar numbers mean. If you don't know, if you're in a new city and you're without your phone and you don't have a GPS, it's really hard to get around, right? And so it's the same kind of thing. You can't make decisions about how to manage yourself if you don't know your blood sugars. So number 1 is check your blood sugars. I'm going to say number 2 is to start working exercise into your lifestyle. The recommendations from the American Diabetes Association is 30 minutes per day, 5 days a week. And that's true for, I think, the American Heart Association too. Everybody, we know that exercise improves, long-term outcomes, and people live longer. But for people with diabetes, particularly type 2 diabetes, where it really matters, it improves insulin sensitivity. And so it's all the more important. And then the third thing, and this is speaking to, to people who have type 1 or type 2 diabetes, and that is take your medicine. And I say that being somebody who I really believe in lifestyle, and I do a lot of education about diet in my clinic. But if you are prescribed medicine for your diabetes, if you have type 1 diabetes and you have to take 4 shots a day, it's really important that you take those shots of insulin every day. And if you're somebody with type 2 diabetes and you've reached the point where you need to take some kind of medicine, it's really important to do that because it will help your long-term insulin sensitivity. So those are the 3, I'd say: check your blood sugars, start exercising, and take your medicine if medicine is indicated.
You actually gave us 4 things. So thank you very much.
I did?
You sure did.
Oh,
yeah. You told us to get
Good.
diabetic education and check our blood
That's
sugars and to move more
true.
and to take our medications. So those are actually the 4 things
Yes.
a diabetic specialist would want you to do starting today, starting tomorrow, or wherever you are in the world. So thank you so much. Yeah, you gave us 4.
Absolutely.
So my
Okay.
next question would be just the opposite. If there are 3 things you would want every diabetic to stop doing right away. That's a hard one because I know your list is probably 2,869
really
things of what you would want them to stop. But
Yes. So, okay, number 1 is so easy. Stop smoking. Okay, not everybody who has diabetes has to do this, but if you are a smoker and you develop diabetes, I always tell my patients in the clinic, it is not an additive risk. So if having diabetes is a risk factor for cardiovascular disease, and it's, I don't know, I'm going to make something up. Let's say it's this 5 points, okay, on whatever scale I'm using. And if smoking is a risk factor for cardiovascular disease, and it's 5 points, and then you smoke and you have diabetes, it's a multiplier. Maybe it is 25, points on whatever scale. Anyway, the point is it's an exponential risk for, cardiovascular disease. So, stroke, heart disease, and peripheral vascular disease. So number 1, stop smoking. Number 2, stop drinking your calories. My words are, when I have patients come into clinic, I give them 4 lifestyle modifications. And number 1 on the list is exercise. We already talked about that. And number 2 on the list is to drink water. I tell them, if the concept here is if you wouldn't feed it to your dog or your cat or whatever animal you have, then don't feed it to yourself. Human beings, from my perspective, were not meant to suck down large amounts of sugar and calories in the form of liquid, sugar. So it's great treatment if you need to treat a low blood sugar. If you have type 1 diabetes, it's just not a great plan for liquids. So drink water and don't drink juice and soda. And then the third thing that I want people to stop doing when I see them in clinic is late night eating, actually. And I notice I haven't really said anything about diet. I'm not going to harp on that right now, but just, I try to explain to people that you can make a huge impact on your diabetes if you change the timing of your eating and stop drinking your calories. Those 2 things can be so powerful. So, nothing good, I think, really happens after dinner. When we get tired, our hunger hormones rise and they make us think we're hungry. So we need that late night snack or a bedtime snack. And unless you have, some medical indication where you're maybe taking insulin or you're having problems, we do have a few people who take snacks at bedtime. That's almost never necessary. And just drives up. And the way I talk to my patients about it is I think it drives up, your need for insulin if you eat right before you go to sleep. The only thing that's going to clear that sugar from your bloodstream is the insulin you're making. And if you are eating during the day when you're more physically active, your skeletal muscle can actually help your pancreas out a little bit. You don't have that at night. So stop the late night eating. There's pretty good evidence that not eating 3 to 4 hours before going to sleep is medically beneficial. And people don't have to be perfect about this either. Perfection is not required here. Just try to do that most of the time. So stop smoking, stop drinking your sugary liquids, and stop the late night eating. Those are the 3 things.
Thank you so much.
And the diet stuff absolutely. The diet stuff comes along with all of that too, but those are pretty practical things you can do.
For the listeners, you may notice that oftentimes for this podcast, I often encourage you to download it so that you might want to listen while you're taking a walk. So maybe this is a good episode that you download and listen to later while you take some of Dr. Kilpatrick's advice and you actually use some of those skeletal muscles. We all could burn off a little of that sugar in our bloodstream. It's never a bad thing. So, yeah, thank you. Those are great answers. I love it. Thank you. So, my next question, and my patients ask me this quite a bit, and sometimes I don't have it, it's hard for me to find a good answer. Does stress affect diabetes? So if someone's just been through a really stressful time and their sugars, they know they're diabetic and their sugars are just, they can't get them in control. Can you tell us like why that might be that like stress would do that to their blood sugars?
Oh, for sure. Absolutely. Stress, I get that question on the daily. I'm sure you do too in your practice. So, it's a very, very common thing. Absolutely, stress makes blood sugars go up. And I think we know more about that now with the use of continuous glucose monitoring devices, where, people who maybe just have impaired glycemic control can put on a continuous glucose monitor and see, if they have a stressful day at work, for example, they can see their blood sugars go up. And so we definitely know that's the case. Family stress at work, we get an increase in counter-regulatory hormones, so specifically growth hormone and cortisol. And those two hormones have the effect of causing your liver to make more sugar, maybe inappropriately so in the setting of somebody with diabetes. And so blood sugars will rise. So definitely we see that increase for sure in the setting of stress. It makes a big difference.
You mentioned growth hormone, and I probably have not sort of begged you for this, but of course, I'm very much hoping I can have you back as a guest because some of the more popular episodes that we've had on this podcast, we're discussing hormones. And I'm imagining that the listeners would really want to hear about hormones from a hormone expert. I've explained it. I think last year we did a series on it. So at some point I may beg, plead, bribe you back to discuss all the hormones because that's a common question. So
absolutely happy to do it.
Thank you. As an endocrinologist and a diabetes specialist, is there anything in your work that you find gives you the most joy? What makes you the happiest?
Absolutely. And pertaining to this, of course, what we're doing right now. So, I love endocrinology just in general. It's a very cerebral field. I love learning about hormones and all the nuances. But by far in my daily practice, seeing patients, I absolutely love my patients with diabetes in a way the most. And the way I view this, we can make such a huge impact on people's lives with not a huge burden necessarily, I think. We can present it in a way that they can really make major changes. And so being able to follow somebody over the long term and see that these impacts, maybe they've lived with diabetes for a number of years and now they're actually able to make changes and believe in themselves and, change their mindset maybe about how they are able to take care of their diabetes. So that is absolutely my favorite thing in diabetes and why I love taking care of patients who have the disease so much.
So for the listeners who have joined us today, I have a feeling that they'll want to stay connected to you in some way. You are a practicing physician, of course, but do you mind sharing your social media so that the listeners that want to see what you're posting, because you're very active on Facebook and I'm one of your followers, do you mind sharing where the listeners could find you?
Oh, for sure. Absolutely. Simply my name. It's actually, and I apologize, I should have said this, Rachel Kilpatrick, MD. So Rachel Kilpatrick, MD. I'm on Instagram, I'm on Facebook, and I'm on TikTok, actually. That's a new endeavor for me. So we'll see where that takes us. But yeah, absolutely.
So This topic, which I'm just so happy, especially because this will be for November, it'll be for Diabetes Awareness Month. So I just have so much gratitude for you joining, and the information you shared is so valuable. I know for us, we do this every day, but for a lot of our listeners, they don't get a lot of time to devote to this, and particularly if they're living with the disease and they're busy with work and family and caretaking, they don't get to focus on this enough. So this is very much so much value. Thank you so much for joining me.
Absolutely. And I hope it does. I hope it helps somebody out there in the world. I hope that somebody takes something away from this and makes a difference in their.
Thank you so much for having joined me for this special episode of the Art of Healing podcast. I hope you found this helpful. And if you did, you should like this. You should share it by email with all of your friends, coworkers, anyone you think could benefit to learn about diabetes. As a special gift to you listeners, one of the things we discussed during this episode is how stress can impact diabetes. Dr. Kilpatrick and I talked for several minutes about what stress can do to the body. And if you followed any of my content, we frequently talk about what stress can do to the mind and the body. I'm working on a very special program to help those of us who are trying to heal our minds and body, and we're trying to recover from diabetes or high blood pressure or anything. So if you are interested in learning more, this program is a mindfulness certification for those who are ready to take their journey to mindfulness. And for those that are interested, I'm going to include some information and some freebies in your show notes. So you might want to have a look in the show notes of wherever you're listening to this podcast. Thank you so much. Thank you so much for joining me for this episode of the Art of Healing podcast. Once again, this is Charlize. You can find out more about me at www.healingartshealthandwellness.com. Did you know I have a blog as well as online courses? Check your show notes to sign up for more information about Healing Arts Health and Wellness. Thank you. Please feel free to share this episode with your friends, family, and loved ones.